Hi, my name is Peria Sabzi, and I have recently graduated from Miracosta Community College as an Associate Registered Nurse. In past 3 years, I have worked as a licensed vocational nurse at a skilled nursing facility, where I have learned that nursing priority is the most important aspect of nursing. Being able to prioritize and change the setup of your day is very important. For example, around noontime one day when I was checking blood sugars of my patients prior to food delivery, I was notified by a nurse, a CNA, that a patient was having difficulty breathing. So I immediately went to the room and assessed the patient and noticed that the patient is short of breath and has difficulty breathing. After administering oxygen, checking the vitals, patient was transferred to bed. Patient stated that he does feel comfortable. I immediately called the doctor because the patient had no history of pulmonary disease or chronic pulmonary disease or pneumonia. After auscultating the lungs were clear. Patient was not coughing. So I called the doctor, explained the situation to him, and requested for the patient to move to hospital for evaluation. Because the patient's O2 sat was not stabilizing, he was fluctuating between 92 to 90 to 85 off and on, going up and down. However, he denied pain. During this time, I still had to check blood sugars for 5 other patients. However, I did ask one of my coworkers to assist me with that, and they did check blood sugars and help me. That is a very important part of nursing. Being able to prioritize places a lot of stress on us as nurses. So in order for me to deal with the stress on a daily basis, I try to have a goal for every hour for my workday. For example, before starting a shift, after getting a report and greeting my patients, I set a schedule that by 9 o'clock I will have my assessments done and charted. That by 12 o'clock I have done my rounds and make sure that all my treatments and procedures are done. And by 2 o'clock I'm wrapping up my day. Even though we set short-term goals, it is still very difficult sometimes to achieve them. But however, knowing that I do have a plan and just having a plan helps me to deal with the stress. And also when a situation becomes stressful, asking for help and actually stepping aside and taking a deep breath and reevaluating the situation does help. I plan to continue my education and receive and obtain my master's in nursing and be able to educate other nurses as well. In the next 5 years, I hope to have that and advocate my time to educating other RNs and patients in the new technology and the progressive prevention of disease. Thank you so much for viewing my video. I hope that you enjoyed it, and I hope that you give me a chance to meet with you and have the opportunity to speak with you in person. Thank you.